When I joined the organization at the end of last year, we were actually struggling to meet the targets for 2020 global HIV targets. But we were struggling. We could see that we will come to the middle of this year when we issue our annual report and find we are off target. And indeed, we are. But the COVID situation is threatening to blow us completely off course. What do I mean? Our report came out a week ago. We call it Seizing the Moment, but it showed tremendous progress over 10 years in reducing new infections, in putting people on treatment, even reducing deaths. But it showed that this success is not shared equally across the world. And therefore, we are not able to achieve global targets because there are many other parts that aren't moving fast enough. The good news is that Sub-Saharan Africa is the most hit region with HIV, but it's the one that has made the fastest progress. For example, the whole world reduced in 10 years, the global average is 23%, but Africa managed to reduce it by 38%. South Africa alone, the worst hit country, reduced by 53%. A small country like South Africa made huge progress on putting people on treatment and keeping them on treatment. It hit the targets, which we call 90-90-90, and moved it to 95-90, went above the targets. So if it can do it, why can't the rest of the world? But then we saw through these results that some other regions, new infections are even rising, like Eastern Europe, Central Asia, rising by 72%. The same with Latin America. The big progress is here in Africa. And we have to understand that that's because of political commitment, putting resources there. And for that, we have to thank development partners, particularly the United States, the Europeans, and the Global Fund. It's also about empowering communities to be able to be at the center to fight for their lives. It's about respecting human rights. And yeah, it's about being focused on results.
What is causing the increase in one region and the reduction in Sub-Saharan Africa, for example?
The epidemic is different in each region. In Eastern and Southern Africa, which are the two parts of Africa that are most hit, the epidemic is driven heterosexually, sex between men and women. There's also gay sex, and there's also sex workers as a very vulnerable group. So we find that there has been a lot of effort being put in to raise awareness for people to go for prevention. So men going for condoms, sticking to one partner, and that is often combined with putting people on treatment, staying on treatment, then you can't infect when your viral load is suppressed. We also use voluntary medical male circumcision. That's another factor that helps to prevent. But the infections, the vulnerability of women and girls remains much higher than boys and men of the same age. There is a real concern, and that's driven by women and girls not having control of their own bodies, and the culture that accepts violent masculinities, harmful masculinities. So there's a lot to do at the level of changing social norms, tackling attitudes and behaviors. In Eastern Europe, because the driver is mainly gay sex and people who inject drugs, the governments there have not paid attention to those groups in terms of giving them their rights, giving them the space to come forward for treatments. They remain underground and they remain unable to access prevention and treatment to stop this infection growing. That's the real reason. The same with Latin America. There are many young people who are in same-sex relationships. But that very Catholic region of traditions has a stigma and discrimination and even laws against gay, transgender, people of non-binary sex, they can't come out. So again, it's human rights, it's social barriers. And once we tackle those, we can reduce the infections.
Can you elaborate on what kind of impact you are seeing with regards to how COVID-19 is affecting the fight against HIV/AIDS?
Oh, thank you so much for raising that. In particular for Africa, it is two colliding epidemics, and it is really it's going to have a devastating impact, and already is. First, we see that our countries were already weak economically, and that meant that they didn't have the resources to plow in health systems. Many countries had already been increasing their debt servicing at the cost of health. Health systems were already crumbling. Now with Corona, there is repurposing. This means that now there are disruption in services for HIV. This is dangerous. We have done an estimate and we found that if these disruptions continue for 6 months at a severe rate, as we are seeing in some countries, we might lose another 500,000 people in Africa in addition to what we are losing already. We might have reversals for children, new infections of children, taking us back to 10 years ago. So there is a danger there because of the dropping the ball on one epidemic to deal with another because of financial constraint. We have to try to keep two balls in the air. But secondly, we're seeing lockdowns. Lockdowns are hurting the vulnerable people who are the ones with HIV or vulnerable to HIV. Sex workers are being denied food and being blamed for transmitting the virus in my region of Eastern Africa because they are saying you are the ones sleeping with truck drivers. Gay men who are already criminalized are being arrested because of their lifestyle. Girls and women, we see the violence against them in the household increasing, more sexual violence. And this means there will be more infections, then more teenage pregnancies, maybe early marriage. We are also seeing that by not being in school and economies crashing, returning to school for girls will be a problem, for poor girls. So all these are risks that we are monitoring, and they are all adding to vulnerability to HIV and to inequalities widening in society.
A lot to tackle, a lot of risks there. So what can be done? I mean, it's so many things at the same time.
I would say that the most important thing is, one, at the global level, that the governments of the whole world see this as a global problem and approach it from a perspective of global solidarity. Where there are resources, help where there are none. Because we are in it together. No one is safe unless we are all safe. That's what our Secretary General Guterres has said, and is right. Two, it's important to be creative about how resources are used. Pull facilities together and fight on two fronts at the same time. Don't drop one. Three, decriminalize same-sex relationships. Honestly, this issue should be left to churches, mosques, and mullahs to be the ones to address it from their perspective of the churches. But governments should repeal those laws so that public services, health services, are available for everybody. Because the government is there to deliver to all citizens, not to judge and say you are not going to heaven, so you won't get your treatment. It's not the business of government to make those moral judgments. That's important. And then in the hospitals and clinics, keep a human rights perspective. You're there to deliver health rights to all, not to judge people, not to judge a girl because she wants a contraceptive. That's not your business. Offer it. Let her mother counsel her on other moral issues. Put the resources to the communities. They are the ones who know. Get communities to shape their own interventions. Give them money and let them work on it. Don't come with your own ideas, lock them up, deny them food, and then remember later that, oh, they're about to die. No, let them shape the response for themselves. Those are the key messages.
Winnie Byanyima, Executive Director of UNAIDS, thank you so much for joining us today.
Thank you for having me.